It's okay. It's okay. It's okay. It's okay.
Thank you.
একসাথে পড়ে যেতে পারেন কাজা করে না মামুন ভাই
জি
জি থ্যাংক ইউ
Imran Bhai, I think we can go live whenever you're ready.
Okay, let's start. Okay, welcome everyone to today's webinar. So today it's a webinar where we are launching and having a discussion on two reports. So one is a adolescent experience of COVID-19. This is focusing on COVID-19 experience of adolescent, and then we have another report that we will also launch and discuss findings of, which is a baseline report on adolescent experiences in Chittagong and Sylhet division. And this is primarily is a baseline report of a very exciting new program of the government of Bangladesh called Adolescent Student Program. And we have got colleagues from the Ministry of Women's and Children Affairs, who is our chief guest today. This is the Secretary of Ministry of Women's and Children Affairs, Mohammed Saidul Islam, as today's chief guest. So we're really looking forward to today's presentations and discussion. But perhaps before we start, I just want to say a few words. So firstly, I think it's absolutely clear that the voice and the impact of COVID on adolescents have generally been slightly muted, and we have not really focused as much as we have in terms of looking at some of the other socio-demographic groups. So I think it's really important that we have today's presentation, which is really focusing on this population group. Secondly, we're focusing on urban, and this is another, we know the importance of the urban dimension in terms of the COVID impact. Studies after studies have basically shown how the urban dimension of the COVID effect is particularly sticky. And the recovery is much slower in the urban area compared to rural areas. So this is also great that this is focusing on urban, and there have been actually presentations on the similar kind of study on Dhaka before. So this is great that we're looking at Chittagong and Sylhet. So I think from that perspective also this will provide a more comprehensive urban picture once we collate all of this together. Thirdly, I just want to also highlight and acknowledge that this is a partnership. This is obviously a global partnership. We're part of the GAGE partnership, which is a global evidence program around adolescent and girls, evidence around adolescent and girls interventions and their situation and what interventions work. We have representatives from the global GAGE network here, but we also have a local partnership in Bangladesh that is actually have been working energetically on this particular theme. So we have got James P. Grant School of Public Health, and we've got the Dean of James P. Grant School of Public Health and other researchers who will be presenting today. IPA, Innovation for Poverty Action Bangladesh, has been a partner of this, and then BIGD sort of as well. So this is a partnership as well, and again, I think taking the spirit of how we successfully maybe have any chance of tackling COVID-19, it is all about partnership, and I think today's this event itself is a celebration of global and national knowledge partnership, but also partnership with our colleagues from the different ministries as well. So I think I really want to acknowledge the importance of taking that partnership-oriented approach as we discuss and figure out, what needs to be done for the adolescent population group, especially in the context of COVID. So with that, I would like to perhaps start off, but maybe just introduce the different discussants we have today and thank them before. Maybe towards the end may not have time. So I'd like to really thank our discussant, Mr. Syed Mamunul Alam, Additional Secretary, Minister of Education, Mr. T.M. Asaduzzaman, Education Specialist and Team Leader of South Asia Educational Global Practice of the World Bank Group. Is based at the World Bank Resident Mission in Dhaka. So we have got these two discussants today. So we really look forward, and thank you very much. And we look forward to an enriching conversation. So let's start. The first presentation is the adolescents' experience of COVID-19 in Chittagong and Sylhet, findings and policy implication. We have 15 minutes in total. It's 6:40. So I'll try and be strict. So there will be two presenters. The first presenter is Dr. Nicola Jones, GAGE Director and the Principal Research Fellow, Gender Equality and Social Inclusion, Overseas Development Institute. And she's actually presenting on behalf of Sylvia Guglielmi, who I guess could not attend, who is a qualitative research specialist from ODI. And then we'll have a second presentation from Farhan Alam, who's the Assistant Director, Center for Excellence for Gender, Sexual and Reproductive Health Rights at BRAC, James P. Grant School of Public Health. So over to you guys. Maybe start off with Nicola. Thank you.
Thank you very much, Imran, and thank you very much for the kind invitation to this very exciting webinar. I'm very happy to be here. I'm just going to briefly introduce the GAGE program and our research approach, and then I will hand over to Farhana to share the findings from this important study. So next slide, please. So in this presentation, we're going to just touch on the GAGE conceptual framework to provide the theoretical framing in which the research has been carried around adolescents' experiences of COVID-19, and talk very briefly about the sample in Chittagong and Sylhet divisions, present the findings according to different capability areas for adolescents, and then conclude and reflect on some of the policy implications, which we'd then love to discuss further with you all. Next slide, please. Next slide, thanks. So to set the scene, the GAGE study is following 20,000 adolescent girls and boys in 6 low and middle income countries, including Bangladesh. And we use a conceptual framework that focuses on the interconnectedness of what we call the 3 C's. So this is adolescent capabilities, change strategies to improve their lives and well-being, and then the broader urban and rural context that we've been discussing in the introduction, in order to understand what works to support adolescent girls and boys' development and empowerment, both now and as they enter into early adulthood transitions. So the framework takes a holistic approach that you can see here and focuses on 6 different capability dimensions. So drawing on the work of Amartya Sen, as well as Martin Nussbaum. So the 6 capabilities that we'll be discussing, the ways in which they've been impacted by COVID, will be education and learning, health and nutrition, bodily integrity and freedom from age and gender-based forms of violence, psychosocial well-being, their voice and agency in the family and community, and also economic empowerment, which importantly in the context of COVID includes access to social protection support. And then the context, we look at micro, meso, and macro level contexts, including the family, the community, and then national and subnational government contexts and policy regimes. And then finally, in terms of the change pathways, we're interested in better understanding what types of interventions can best fast track social change for adolescents at this pivotal stage in the life course. And so the program of adolescent student development in Bangladesh is a critical example of that. And so we're very excited to be looking at that evaluation of that program. What's key is that we're interested not only in interventions that work directly with adolescent girls and boys, but also in their involvement of parents, community, and norm change champions, as well as in strengthening broader systems and services. Next slide, please. So the research that we have undertaken during the pandemic has been nested within our broader longitudinal sample of 20,000 young people, and we've drawn on a mixed methods approach, so including both survey research undertaken during the pandemic using telephone surveys, as well as more in-depth qualitative interviews undertaken either through phone or internet-based platforms such as WhatsApp. So we have included interviews both with adolescents as well as with key stakeholders, so both government and NGO actors who are working to mitigate some of the impacts of COVID-19 and the related service closures and lockdown. Next slide, please. So this just provides a snapshot of the timeline of the different rounds of research that have been undertaken to date. So there was two rounds of data collection in Sylhet and Chittagong with adolescents and caregivers prior to COVID-19. And then there has been follow-up research in 2020 and 2021 to better understand both the immediate effects of the pandemic as well as some of the slower onset implications for adolescent well-being across the 6 different capability dimensions that I outlined. And so with that, I would now like to turn over to Farhana to talk more about the findings and the specific sample in Chittagong and Sylhet divisions. Thanks very much, Farhana.
Thank you, Nicola. So I'm going to start by giving you an idea about the qualitative sample for the study we did in Chittagong and Sylhet. Next slide, please. So the qualitative data collected, the data collection time was from July to August 2020. We have done 39 adolescent interviews and 13 key informant interviews with school teachers. As you can see, adolescent girls and boys from grade 7 and 8, which included working adolescents, adolescents with disabilities, and adolescents from female-headed household. These 39 adolescents were purposefully selected from a GAGE baseline impact evaluation survey with more than 2,000 randomly selected adolescents attending grade 7 and 8 in public and semi-private schools in Chittagong and Sylhet division. Next slide. So when I'll discuss the findings, these are some of the topics that we'll talk about, which are adolescents' knowledge on COVID-19, education and remote learning, incomes and livelihoods, nutrition, health and hygiene, their psychosocial well-being and coping, and voice and agency. Next slide. So when we talked about adolescents' knowledge and practices about COVID-19, it was generally good, but rural adolescents had little or no knowledge about the signs and symptoms of COVID-19, some of the rural adolescents, not all of them, compared to the adolescents in urban areas who were found to have more precise knowledge on COVID-19, which can be because of their more access to various sources of information. To protect themselves, most adolescents mentioned that they're wearing a mask, washing their hands, and practicing social distancing. Most of the adolescents suggested various home remedies to cure and recover from COVID-19, such as drinking hot water, taking painkillers, having citrus fruits, and other herbs like tulsi, cloves, etc. Next slide. When we talked about education and remote learning, most of the adolescents, they mentioned that closing the schools was a good response to the pandemic. However, they also mentioned that leading to reduced study hours and loss of interest in studying. Phone and internet connectivity, limited access to personal devices, and expensive credit, all of these pose key barriers to continuity of learning, especially for rural adolescents and teachers in rural schools. While we report few gender differences, location matters. Adolescents in urban and more affluent areas are more likely to have private tuitions, steady access to devices, to follow online classes, and benefit from various learning platforms. Next one. Regardless of the gender and location, most of the adolescents, which is 31 adolescents out of 39, reported that their families faced economic hardship during lockdown due to loss of income, loss of jobs, or because of they had to close their shops. Their families were dependent on income sources such as agriculture, transportation, garments work. They faced the most of economic burden during lockdown. While most reported that the family members were returning to work at the time when we collected that data, others mentioned losing their job and struggling to cope with loans and credit mounting. Next one. Most of the teachers, when they talked about incomes and livelihoods, they said the pandemic had gravely impacted the whole community, with the poorest being the worst affected. Family economic hardship was found to directly impact adolescents' lives because they had to contribute to increased household work, with boys taking care of livestock and cutting wood, and girls more involved in household chores. Some adolescents reported that they are learning new skills during this pandemic time when they're at home, such as sewing and running a grocery shop because their schools were closed. Next one. So when it came to nutrition, health, and hygiene, economic fallout has resulted in a reduction of daily food consumption for many households, which compromise their nutritional intake. As the adolescents in our sample, they're from different socioeconomic background. Not all of them reported the need for receiving government aid. However, a few of them from relatively low-income households mentioned that they did not get any support from the government or the community, although they would have benefited from this assistance. Some of them mentioned the shame and stigma around receiving the aid, which also stopped them to ask for help. Because of the time, I'm not reading out the quotes, but you can see we have added some of the quotes from our findings from our respondents. Next one. Psychosocial well-being and coping, which was we wanted to explore it more because adolescents are sitting home because of their school is closed and they're not meeting their friends. So how they're coping with this new normal. The findings indicate that many adolescents have faced social isolation, boredom, and exhaustion because they miss their friends going to school, and they also miss the normality. Watching TV, using mobile phones, especially for urban boys, were common coping strategies to deal with boredom. Some adolescents, both male and female, also mentioned doing some activities such as drawing, reading storybooks, etc. Education-related uncertainty was reported as the most common source of their anxiety, along with the family's financial struggles, which was also mentioned frequently. Next one. When we talked about the voice and agency of the adolescents, our findings reveal stark gender differences in voice and agency. Due to the cultural traditions, adolescent girls have limited mobility compared to boys, while some reported new restriction imposed by their parents because of the pandemic. While adolescents relied on phone to contact friends, girls' limited access to personal devices also restricted their communication with their friends. Adolescents' boys were found to have more flexibility and agency regarding their mobility. Next one. So from our findings, we concluded with some policy implications that can help adolescents to cope with this situation better. Next slide. So in the light of our In the light of our findings, we propose some key priorities for policy and programmatic responses to help the most vulnerable adolescents and their households recover from the COVID-19 induced economic crisis, which are: firstly, the Ministry of Education and private organizations working in the education sector should identify and address educational gaps created by COVID-19, along with poverty, geographical location, and gender, to especially help adolescents from rural and poor families who had limited access to distance learning during the academic year. There is a need to review and restructure online study materials, distant learning modalities, and teacher training. The differences in access to and affordability of digital modalities across socioeconomic groups and genders risk further risking there's inequalities between different groups in the community. Number two, which is limit existing class and gender divides during the school is closed by reducing mobile data costs and piloting low or no tech distance learning options. Ensure that differences in access and use of online resources across socioeconomic groups and genders do not increase existing class and gender divides during school closure by reducing mobile data costs and uptake of low or no tech distance learning options. This also involves reinforcing the importance of recreation opportunities and scope for adolescents to engage with their respective communities and their studies. Number three, improve awareness of adolescents' psychosocial needs and provide opportunities for adolescents to volunteer in their communities and access recreational facilities. And number four, the government, NGO, and other stakeholders should act swiftly to mitigate the immediate potential nutritional risks faced by adolescents, as our findings show that adolescents, particularly those from rural areas who tend to live far from services, have faced difficulties in accessing healthcare due to unavailable and overcrowded public transport system. So this is all from me now. We can.
Thank you.
Hello. I don't know. Yeah, thank you. I'm done.
Thank you. Thank you very much, Dr. Nicola and Farhana. This was, I think, you kept to time, so thank you for that. And I think a lot of food for thought. So, I'd like to now request TM Asaduzzahman, education specialist and team leader of South Asia Education Global Practice of the World Bank, to give his comments. And I would really request, if possible, trying to keep it within 7 minutes, if possible. Thank you.
Thank you, Dr. Imran. Good evening to you all, colleagues and friends who have joined here today. Thank you for inviting me to share my thoughts on this very interesting report. So from the education point of view, I think both these divisions are of big interest since the education outcomes tend to be lower on the lower side. And also, moreover, these two divisions host few upazilas that are classified as disadvantaged by the government. And then, of course, the Adolescent Student Program under the World Bank funded Transforming Secondary Education for Results comes in at the right time to overcome many of these challenges mentioned in the report findings. However, two things that will be very important for us to look out for is definitely preventing school dropout and accelerating learning recovery of adolescents as we move forward with school reopening, and also strategizing our interventions to make sure that we address some of these challenges. And now going back to the findings of the report, we all know that the education sector beneficiaries comprise a significant share of the total country's population. And then also considering the challenges imposed due to COVID, we need to focus on school environment to improve adolescent outcomes, which is something which definitely is on our cards. And here I would like to give an example that considering the high enrollment of females in secondary schools, so the bigger question we need to ask here is how can we incentivize female teacher deployment, especially in Howard and Chor areas in Sylhet and remote areas in Chittagong, which are categorized as disadvantaged areas and has very few female teachers, and whether there is a need for reform in the teacher hiring policy. So I think these are things we really need to have further brainstorming on. And another important aspect is how we take advantage of the existing structure in school, such as the student cabinet committees and the sexual harassment committees, and how we can make it more functional and active. And I think here the Ministry of Education has made very good progress on encouraging schools to use these committees, but we need to continue to build on the effort and sustain. And I think that's the key as we move forward. And now also talking about the challenges pertaining to mental health, gender-based violence, child marriage. I think here we should take a multi-sectoral approach, and here Ministry of Education should collaborate with Ministry of Health and even other ministries such as Ministry of Women and Children Affairs. At the same time, we should also encourage collaboration at the local level to allow more access of adolescents to mental health support and reporting of gender violence. Now, as we speak about these ideas, I was wondering at the same time that can technology be the one-stop solution for these problems? And I say this is because, for example, the human development sectors can collaborate with ICT Ministry to encourage adolescents to use dedicated hotlines for mental health support, for reporting child marriage, which has been a big issue during this COVID period. And then, of course, gender-based violence, which also kind of impacts the adolescent outcomes overall. So, and we all know that the government has done an excellent job, again, on this front. I mean, building upon the Digital Bangladesh commitment. And our job would be to continue empowering the adolescents using technology as a solution. So something to think about. And final thing I would like to also note here is that during COVID, the economically disadvantaged adolescents and their family members benefited from the government's formal stimulus package. And also other conditional cash transfers such as stipend. Um, and this support was very timely and will need to continue. But as education sector envisions towards school reopening, uh, the most important question for us right now is how we can capitalize on adolescent productivity to take advantage of the demographic dividend, and also how can we help Bangladesh reach the upper middle income status, something to focus once schools resume. And I think we probably need to have more discussion on how we strategize our interventions accordingly. So, colleagues, in the interest of time, I'll stop here and thank you for having me. Back to you, Dr. Imran.
Thank you very much, Mr. Asaduzzahman. I think you raised a number of extremely important points, and I hope we can get back to having some discussion on some of those. This would be really, really important. Just on your last point around adolescent or youth productivity and demographic dividend, I think this has got a real implication for our vaccination strategy as well. And I think our whole vaccination strategy needs to really think about about the productivity challenge here and the demographic dividend challenge. One of a recent survey that we have done on some BIGD on looking at willingness to vaccinate among youth, we noticed between February and March, the willingness to vaccinate is actually declined. So I think there are important discussions to be have to be had in terms of connecting some of these dots and having a more comprehensive way of approaching, what is, kind of a multi-dimensional chess that we are trying to play here. Thank you very much. Let's move on. We now have the second presentation. Now this is on adolescent experience, again, Chittagong and Sylhet division. This is the baseline report of this program, the government program, the adolescent student program. I think we have two presentations here. The first we have from Dr. Jennifer Seeger, Assistant Professor Global Health and Economics from George Washington University. And then we have Mahin Sultan, Senior Fellow of Practice at BIGD, will be giving the second presentation. Over to you, but I just want to basically, for the audience and when we get into discussion, to keep in mind that though we are having these two as separate presentation, one is on COVID context, one is on, this baseline report, I don't think we should get too caught up in this whole baseline versus a kind of a COVID. All of these, I think, need to be taken together for us to really think about, the challenge of education and the challenge of school reopening, the challenge of learning, all of that. So I think we should really, kind of take it in a more comprehensive step back way. So that's what I would really request everyone, not to get too caught up on the, two parts of the presentation. But over to you, Jennifer.
Thank you. So we're going to be presenting now, as mentioned, some baseline findings from in-school adolescents in Chittagong and Sylhet. And the findings that we'll be discussing here come from a recently published baseline report that we co-authored with Sylvia Guglielmi, Farhana Alam, Sarah Baird, Nicola Jones, Tiama Sadhusaman, Deepika Ramachandran, and Shwetlana Sabarwal. So this is really a collaborative effort, as has already been mentioned. So we can go ahead on to the next slide. Once we have.
Sorry, just a second. I'm just having some technical difficulties from my end. Please bear with me.
I think just need to enable editing and then. So just in the interest of time, so a brief outline that we'll be discussing. So I'll be providing an overview of the adolescent student program. So we can go back to the previous slide. Yeah. That the baseline data is supporting in evaluating the adolescent student program. And then we'll discuss the samples at hand. And then move into discussing a selection of the findings around education and learning, psychosocial well-being, and economic empowerment and voice and agency. Just to note that this data collection, is also within the GAGE program and is the larger sample from which the COVID-19 sample was derived from the previously reported results. And so our findings and research also falls within the previously discussed conceptual framework. So we won't be representing that now. Next slide, please. Next slide. So the adolescent student program is being implemented and evaluated by a collaboration between the government of Bangladesh, the World Bank, and the GAGE program. And the program overall aims to alleviate constraints to continued education of adolescents with a focus on trying to increase grade 10 retention now and since the onset of COVID-19, also thinking about re-enrollment in school. I'm going to talk about the interventions that are involved with the adolescent student programs in two groups. The first of which are testing of evidence-based approaches to prevent dropout and improve re-enrollment. And so these include a growth mindset curriculum, which teaches students about the malleability of intelligence and teaches them how to adopt a growth mindset that whereby they can improve their basic skills and intelligence through continued hard work. And also a Girl Rising curriculum that focuses on shifting gender norms around education, with a particular focus on increasing enrollment and continued schooling of adolescent girls. The growth mindset intervention is currently being implemented over these past couple of months, and the Girl Rising curriculum will be implemented later this summer, both of which are being delivered, well, virtually at this point for growth mindset. And then, of course, both of these curriculum are being implemented among the sample of adolescents that these findings are being presented from today. And then more broadly, ASP aims to improve infrastructure of schools, provide teacher training, and improve community outreach and support of students. So the ASP program has provisioned for development of wash block and drinking water facilities in 3,500 institutions, including those included in this study in our data here. More than 13.7 million students, around 8 million girls will be benefiting from the ASP program in areas of awareness, hygiene facilities, and medical checkups. Nearly 5 million girls will also be receiving menstrual hygiene management grants. And additionally, more than 19,000 institutions will benefit under awareness campaign, and nearly 140,000 teachers will receive some additional training around sexual reproductive health, mental health, and other areas. Next slide. Next slide. So to introduce the quantitative sample, the findings here come from a sample of 2,220 in-school adolescents who were attending grades 7 and 8 in Chittagong and Sylhet divisions in Bangladesh. And they were attending these grades in February and March 2020, which is when this data was collected through face-to-face interviews just before the onset of the COVID-19 pandemic for the quantitative data. The adolescents come from 109 schools in total, most of which are these MPO schools, and about 75% of our sample is in Chittagong. On average, adolescents are 13, and a little over half are female. And so now I'm going to hand it over to Maheen to discuss the qualitative sample and begin presenting some of the findings. Thank you. Next slide.
Thank you. So I won't spend too long on this. This is the qualitative sample, which supplements the quantitative sample. And this is the larger qualitative sample than the one that Nicola and Farhana mentioned, from which the COVID sample was drawn. So next, please. So for today, the report has more, but we would like to highlight some findings relating to education and learning, psychosocial well-being, and economic empowerment. And as Jennifer mentioned, this is part of the framework that Nicola has mentioned. Next, please. So in terms of, in terms of education and learning, we found that both the qualitative and quantitative findings emphasize that there's a lot of importance given to education among the adolescents and their families. And they see education as a social good. It's good in itself. And this is perhaps not surprising because they are in secondary school. But what we found very interesting is that this also translates into very high educational and professional aspirations, that even up to 90% are aspiring to university education, and 91% are aspiring to professional careers. And interestingly, it's not just vague aspirations, they really know the steps involved to get them to these careers or to higher education. And also we were all looking for gender differences as well as, between rural and urban. But among the gender difference that we recognized is that there are some stereotypical beliefs. While the parents are saying that they are equally interested in both boys and girls' education, but the boys believe that their parents favor the education of boys over the education of girls. You can see the figures there. And also interestingly, the boys were thinking that only boys should study STEM subjects. And that's 14%, it's not on the slides, but it's in the report. 14% of boys thought that they should, only boys should study STEM subjects, and only 8% of girls. Next, please. While 52% of the survey respondents didn't see any barriers to achieving their professional aspirations. 25% were thinking or thought that their education and skills would be a constraint to achieving these aspirations, and 17% mentioned financial constraints. So this leads me to the point that the adolescents are aware of and concerned about that the quality of education that they're getting. So they were commenting on the teachers' attendance, the quality of teaching, how the homework was assigned, how the students are engaged in class. And this concern is linked to their concerns about their future, because they think that unless they get a solid education, a good educational foundation, this will affect their future prospects. Another point that came out is that both quantitative and qualitative findings told us that girls were very concerned about negative experiences of menstrual hygiene management. In spite of the infrastructure available, 45% of the girls said that only 45% of the girls said their schools had facilities or resources that they could use during menstruation. And there is a rural-urban divide here, with rural schools having less facilities and rural schools having better management of this. Interestingly, both boys and girls felt that girls should not be missing out on school during this period, but some of the schools went so far as to say that girls shouldn't attend school during their menstruation. Another area with a gender difference is the importance of social interactions and school for forming friendships. And we found that this was more important for girls than for boys, which I guess reflects the fact that girls have less social interactions outside school than do boys, which had an implication for what happened during the COVID period and their isolation. Next, please. Oh, and also linked to their social life in school is the fact that only 9% of the adolescents mentioned that they were involved in any kind of extracurricular activities or clubs. And those who were really valued this. So there's also something to be learned from that. So I'd like to present just some of the key priorities that seem to us linked to education. One, which already Asad Bhai had mentioned, this importance of increasing the share of female teachers at the secondary level to improve adolescent outcomes. And the interviews, the girls especially mentioned that this was very much lacking in the remote schools in the Haur and Chor areas and the remote areas in Chittagong. And so they really felt this lack. Another issue we think important to emphasize, that there are grants available from the Ministry of Education from these larger programs, which can be used for, which are performance-based grants, and schools should be encouraged to prioritize what matters to the adolescents, to use this for things like workshops on adolescent-sensitive topics or awareness raising on issues of child marriage, which we found the children are interested in and want to work on. Another emphasis we want to give is the importance of teacher training so that they can deal with adolescent-specific topics, such as nonviolent discipline or pedagogical skills. And finally, emphasizing menstrual hygiene management so that it's not a barrier for girls, adolescent girls going to secondary school. Next, please. Another dimension we would like to emphasize today is the importance of psychosocial well-being, because adolescents in that age group are more vulnerable than other population groups because of their developmental stage, and also because of the COVID pandemic leading to the closure of schools. So if we look at the adolescents' views of what makes adolescent boys and girls feel good, we can see that doing well in school, their parents' appreciation if they do well in school, spending time with friends, all of these things makes them happy. Overall, the rates of depression appear to be low. Only about 1.3% of adolescents can be classified as depressed, with slightly higher rates for girls. And some of the reasons for feeling sad are being cut off from friends, worried about poverty. Next, please. we tried to see what were the support systems available for them, for their well-being. And we can see it's both parents and teachers. And in terms of parents, it's both in terms of practical needs and emotional support that they're providing. I won't go into this in detail. In terms of support from teachers, they're getting support in terms of education, but both the teachers and the students feel that they lack counseling services. Next, please. So that's why we'd like to emphasize that among the priority needs, there's a need for further collaboration between Ministry of Health and Education, especially at the local level, to address adolescent mental health needs, to facilitate access to mental health support. Perhaps this can be done through the Union Health Complex Centers or dedicated teacher training so that the teachers can provide some support. And there's a need to enhance awareness of the importance of adolescent psychosocial needs, both among parents, teachers, and students. I think now I'll hand back to Jennifer. Next, please.
Can I just say about 2 to 3 minutes, but maybe I can give you maximum 5.
That's perfect. Yep, that's perfect. So moving into some findings around economic empowerment and voice and agency. Given that this is an in-school sample, we do have a relatively small share of adolescents that are reporting being involved in paid work. 5% of adolescents do report being involved in paid work, most of which, or about half, is non-agricultural wage work, with another 20% in farm work, and then 20% in sort of other types of activities. But most of this, thinking about involvement of adolescents in unpaid household work, and there are some gender differences that arise. And so in the baseline data, girls were spending about an hour per average per day, an average of an hour per day on household chores compared to 40 minutes among boys. And we did see that, during some of the COVID-19 findings, that girls were increasingly likely to report increasing shares of chores. And we have a quote here that sort of highlights, I think, gender differences in the types of unpaid labor that adolescents are engaging in, and also illustrates how gender norms are shaping these tasks. And so this is a 12-year-old boy who says that girls do household chores. On the other hand, boys take care of domestic animals, help their fathers with his work. What boys can do, girls can't, and what girls can do, boys can't. And then finally, thinking a little bit about voice and agency around the types of unpaid labor and educational attainment of adolescents. Most adolescents are reporting that they're able to have a say in these decisions. 91% of adolescents report that they have a great deal of say in how much education they complete. And about 48%, or about half of adolescents, report having a great deal of say in how much time they spend doing unpaid household chores. And if we look at having at least a little bit of say, 90% of adolescents. And we don't see any gender differences in the amount of say that the adolescents have in these areas. Next slide. And so to conclude about economic empowerment, voice, and agency, I just want to point out a couple of priority areas that we saw. So one in particular is thinking about this in the arena of unpaid work, and particularly thinking about transition back to school post when they reopen, is providing home economics classes in schools so as to valorize unpaid household work. And also to continue to build awareness through both formal and informal channels around gender norms and attitudes in order to reduce, gender disparities in this unpaid household labor, continuing education, and to sort of decrease disparities in economic, in work and education outcomes. Next slide, please. So that sort of concludes the summary of findings that we wanted to share for discussion today. We have more information in our baseline report that's available online, and of course, we're happy to continue this discussion on any of these topics. Thank you.
Thank you. Thank you very much, Jennifer. Really interesting. Yeah, I hope we get to all of some of these in the discussion. Let me now invite Mr. Syed Mamunul Alam, Additional Secretary, Minister of Education and Program Coordinator of SEDP, and who also oversees the Adolescent Student Program as well. So, Mr. Mamunul Alam, over to you for some comments. And you have about 5 to 7 minutes max. Thank you.
Thank you very much, dear friends and colleagues. And personally, thanks to Jennifer Chiar and Ms. Mahin Sultan for their excellent presentation. Before introductory meeting, I tell you I am in the Ministry of Education for just couple of days. So, what policy and program are taken by the Ministry of Education, I am not well aware. But in the broad context of Bangladesh, I like to share my experience. I like to share my comments. Bangladesh was a less development country, and very recently it is graduated from a developing country. But still now, we have faced many reservations and difficulties. Before coming to a pandemic situation, in Bangladesh, 21% people live under poverty level. And during the pandemic situation, we heard the poverty rate already increased about 42%. And adolescent education, adolescent facilities, adolescent everything depend on the poverty level of their parents, of their family, of their day-to-day life. And we know enrollment in Chittagong and Sylhet area incompatibly less than other area of Bangladesh. If I know what is the region by taking the consider this area for this study. If I know, then I could understand. Government already taken many initiatives about women and especially secondary education people, including girls and boys. We have already taken a good number of projects by Education Ministry before, by UNFPA assistant, UNICEF assistant, and very recently government taken up the sectoral approach program, and including and within that program, government already taken an adolescent secondary student program. You know, our education minister is a woman. Not only that, she is a medical science student. So she is very much aware regarding the findings you have mentioned in the report. And day to day, he is instructing all competent authority to take necessary measure. But as the pandemic situation did not overcome, that's why all program, all activities from the Minister of Education is not going to be fielding. And we are hopeful when the pandemic situation is over, government will take all necessary measures for the girls and boys, those are now in adolescent situation. Government already taken a program, adolescent student program. For your kind information, I like to mention here, we have many activities within that program. We have considered capacity building of teacher, assistant head teacher of life skill based, reproductive health, gender education, counseling training for teacher, monetary incentive for girl, ministerial management, intelligent improvement program, and many activities already government taken. And as far as the pandemic situation is over, people, those are working in the secondary education sector, they will take necessary step. And when the ministry will get the many findings like your report, they will consider all those findings, recommendation, suggestion, and will align their future policy and program. So this point of view, I like to thank you all. Whenever we'll get the report from you in the ministry level, we will align, we will match many program ongoing and in future program. Thank you very much.
Thank you, Mr. Mamunul Alam. It's very encouraging that you know what you said, and I'm sure our policy briefs and full report will be available, and we will definitely share with you, and very open to subsequent discussion, because policy briefs, you know, may not be enough in terms of actual programmatic implication. So we'll be very happy to have subsequent discussion. I mean, in particular, my colleague at BIGD, Mahin Sultan, is responsible for the policy uptake of all the research that we're doing from GAGE. So we'll be very happy to engage. So thank you very much. So I think now we will move to open discussion. I think there are comments which we can take from online, but maybe before we sort of start, I just want to, you know, just from my point of view, try and, you know, kind of what I've heard and try to bring out some salient points, perhaps which may help in framing, you know, the questions and discussion. So firstly, I think we are really at a, you know, I mean, I think the most lasting crisis of COVID is going to be around human capital. That is going to be the most lasting crisis, and the socioeconomic inequality through which this crisis is going to manifest itself is going to have pretty important implications and consequences for the kind of Bangladesh we want to create. So I think that's the first thing that we need to first acknowledge, and then kind of think about what needs to be done. In a nationally representative rural and urban slum survey that was conducted by BIGD in partnership with PPRC, we find that 19% of primary and 25% of secondary students, that's about 2.5 million students, are at learning loss risk. And that's a lower bound in terms of learning loss risk, because we considered unsupervised study, only unsupervised self-study as a risk. But we know that a lot of the coaching that is happening can also be of very poor quality and would lead to learning loss risk. So we are actually going to be, whenever we decide to open the school, and I think you should think of that sooner rather than later, we'll be starting from a situation where there is a huge backlog of learning loss risk, especially among the poorer segment, right? And I think that is the reality with which we'll be starting. So I think that's another reality we do have to keep in mind. The immediate dropout is not going to be a big problem. The problem is going to be the subsequent waves of dropout that may happen into the future. And I think that's something we should keep in mind, right? So unless we really tackle the learning loss risk head on, I think we are really at a big risk of a human capital depleted Bangladesh. And forget about all our demographic dividend and all of that stuff. We are actually going to be entering into quite deep risk of social unrest. And I think that's really, really important. And in a context of low labor market employment opportunities. So this is going to be quite a big crisis that is looming that we need to take seriously. Now, 3 points I think that came out from today's. I just want to set that context in 3 points. So one is, I think the gender dimension has come out very, very strongly from these from today's presentations, and within that there are 3 interesting dimensions. One is there's a whole self-belief aspect of this gender norm that is starting so early. We can see in adolescent already. We can see how boys think that they should be, the one that should be, in terms of choice, they should be the ones who can continue education. You can start, they should be the ones studying science and STEM and all of that stuff. Girls should not be doing this and that. So the self-belief thing, I think this is one very, very extremely important point that's emerging. And I think the intervention that as far as I have read about it, is going to be around this growth mindset. But I think it should take a very gendered-oriented approach to the growth mindset. That's going to be really, really important. The second is digital divide and the gender dimension of digital divide. And we have not seen this here, but a bit here, but separate studies under GAGE has been done, which BIGD has been involved in. And we have seen how adolescent girls, how gendered this digital divide access is. I mean, simply put, for the same amount of time, the norms are such that boys' usage of digital devices is seen as productive and information seeking, and girls' use of digital devices is seen as sort of moral decay, and that actually creates a huge pressure in terms of creating the gender divide. And I think this is another area that I think we need to look at. And the third is the empirical fact that actually, and this is from our survey from BIGD PPRC survey, we find that actually we see that the learning loss risk is actually highest among secondary boys in the urban area, right? So the reality is that actually the livelihood pressures in terms of labor is much higher for boys, and that's the empirical reality. So there's a normative reality, which is really important, and there's empirical reality. And I think we just need to really understand these much more. The second point is really on learning loss and catch up, which I really talked about before. I think we really need to pay attention to this. But within this, I think in the research also, we talked about hybrid technology, community radio, I think is something that we should definitely look at. The government has only licensed 13 community radio stations. This needs to be massively scaled up. I think this is an area I think we should really look at, because I think, and hybrid technology between community radio and feature phone. I think this is how we should be really thinking. Low-tech technology and hybrid technology is the way forward in terms of using technology for learning loss. And the third dimension that has really come up and really important is the psychosocial well-being. And this has become so critical. And it is just staring at our face. In a youth survey that BIGD did, over 50% of the youth basically reported some kind of mental stress. And this is really important. And I think the psychosocial well-being has to be really mainstream in our thinking. So any intervention around learning loss needs to really address head-on the psychosocial well-being issue as well. Because just a technocratic approach in the way we would approach learning loss may not work unless we approach the psychosocial well-being, which is going to be so important in terms of actually creating effective catch-up of the learning loss. So I think we need to mainstream and integrate psychosocial intervention as a part of education. This is going to be really important. So those were some of my thoughts, but let's get to some discussion here. Thank you. How should we do this? I can see some questions. Are there people who may want to raise there? I don't know whether there is an opportunity for this. I need some help from colleagues. There are 44 participants here. So if there's anybody wants to come in, and then while I read some of the questions, I can try and come to that.
Musharraf sir has raised his hand. So sir, I'm giving you permission to speak if you would like to.
Can you hear me?
Yes,
yes.
Thank you.
Thank you, Imran Bhai. I thank the researchers as well as the panelists and all the participants here. I was listening, and it's an enrichment process as well, at least for me. My intervention will be very brief. I believe adolescence programs includes a number of ministries and agencies, such as Ministry of Education, Ministry of Women and Children Affairs, Ministry of Health and Family Welfare, and also ICT division. Why ICT division? Mainly because, as I understand, during pandemic, digital infrastructure becomes more important. And we have witnessed that the digital divide widens during the pandemic. These research papers have also come up with this observation. So given the situation, I strongly feel that taking a whole of government approach with regard to adolescence is critically important. And I will be expecting some comments from our chief guest, Mr. Saidul Islam, Secretary Mocha, this evening. Thank you.
Thank you very much, Musharraf Bhai. Obviously we all know Musharraf Bhuiya, ex-cabinet secretary, but Musharraf Bhai is with BIGD right now, and we are extremely proud to have Musharraf Bhai. He's a senior advisor to me on government partnership. So thank you very much for your intervention. Great. I think there's a question here from Shahnaz. In this COVID situation, all of the schools are off and the online courses have proven to be only partially suitable. Is there any strategy for recovering the year of schooling that was lost by the school children? Maybe I will keep that question for our chief guest, who I'm sure can reflect on that and can let us know what the plan is. And this actually is the fundamental question, really. I would love to hear from you, sir. Is there anybody else who want to raise any question?
We have a question on the Q&A panel. So the question is, do you find YTV classes are difficult to follow for the students? So if anyone wants to answer.
I don't know if any of the presenters would like to take this on. This is really on the TV classes. Do you have any insights from qualitative or from quantitative in terms of why? Yeah.
Farhana can answer that.
Farhana?
We have findings. Are you there, Farhana? Otherwise, I'll just step in. Like in the interviews, we found that why the online classes are difficult to follow. Well, one is not everybody has access to television. Even if they have a television at the house, they don't get watching time when other people are watching it. The classes they need are not, they're saying, are not repeated. And then we found that they don't always have access to the internet. As Imran mentioned, that the boys have more access to the internet than the girls do. And even if they have access to the phone, they can't use it for getting the lessons. So there were various reasons we found that, which would explain why they found it very difficult to follow the online classes. Also the fact that electricity failures, these are some of the issues that came up.
Thank you, Mahina. I think generally the nature of the television classes is non-interactive. So anything non-interactive is not particularly effective. So I think we should be thinking about low-tech, hybrid, interactive technology. And that's where the innovation needs to basically happen. Any other question? Anybody else?
We don't have any questions on the chat on the Facebook Live, so I think we can move on to the next segment unless anyone has any questions and want to raise their hands. If not, I think we can move on.
I just wanted to make a comment for a minute because I want to take up from what Imran was saying about interactive. So what I found with some of the studies I was talking to some of the people in BRAC education program is the radio schools were so successful where teachers were super engaged and they were really active in the communities, knew the parents. So they served a real bridge in terms of motivating young people to come to school. And it was very creative learning. And I think it's very important because we feel that any mode of technology will work. And I do think from our research at GAGE, that JPG is doing with BIGD, I would like to emphasize once again the non-tech options, because I agree, if we're looking at marginalized groups, who drops out of school, who gets married early, it's the poor households. And we need to figure out strategies that address that. And the non-technology gives a much wider opportunity for access. So I just wanted to share that as part of the.
Thank you, Sabrina. Yeah, this is absolutely right. I think, you know, technology offers a lot of possibilities, but we should never forget that technology needs to operate within as a social innovation. It needs to operate within a social innovation, you know, kind of a platform. And our biggest structure of social innovation is our community-based mechanisms. We should never ever forget that. Never get too allured or by technological adventurism. I think we should take a critical perspective and really look at the end game and the real outcome that we are really trying to get in with a very strong equity focus. Because otherwise we'll just have tick boxing approach to technology that just looks very nice, that we can make like nice video clips about, but doesn't really have any impact in the lives of the people that we want to have an impact on. Great. So I think let's move on. I would like to invite Dr. Nicola Jones to perhaps I provided some kind of a summary highlight from my point of view. But Nicola, I'm sure you're going to bring out some other new perspectives and points. Nicola, over to you.
Thanks very much, Imran. Many of the things that I was going to reflect on, you presented extremely eloquently, so I'll just try to build on those and perhaps share some comparative points from research and other contexts. I think what really stood out to me was the very encouraging findings around the high levels of educational aspirations of girls and boys from both divisions that we heard earlier are known for some level of disadvantage in terms of education, but also that, as Maheen highlighted, the really detailed understandings of what's needed to then realize those aspirations. And this is markedly different to our findings in other low and middle income country context in GAGE, where we've seen that there's a real disconnect between aspirations and concrete knowledge about how to attain them. So I think we should see this as a very positive foundation to build upon during this really challenging time of the pandemic. But then I think in line with Sustainable Development Goal 4's focus on realizing inclusive and equitable quality education for all adolescents, what's going to be key is to ensure that there is widespread access to social protection for education purposes for adolescents that are facing both economic and social vulnerabilities. And we heard about the importance of investing the Minister of Education school grants in adolescent-friendly ways. But I think there's also a real need to ensure that there's expanded access to either cash transfers or educational scholarships. And that this is going to be especially critical with the reopening of schools to encourage re-enrollment and make sure the most marginalized do come back. But also that, as you were pointing out, Imran, for the risk of loss of learning over time. And we're already seeing in other contexts where schools have reopened that many students are not re-enrolling and that the quality of catch-up programs has been very poor. So I think there's quite a lot of lessons to be learned from other contexts where there's automatic grade promotion even after students have missed half a year to a full year of schooling. They're then getting 20-30 days of catch-up with reduced classroom hours. This is not going to deal with the human capital risk that we've all been discussing. I think what also comes out really strongly is this issue that we're hearing in Bangladesh, but also in other contexts, the importance of investing in strengthening school and community-wide efforts to tackle the risk of social protection, both on the way to school and then at school. And I think we've heard some very important initiatives that the government of Bangladesh is already implementing in terms of the sexual harassment committees in schools and some of the digital reporting mechanisms. But perhaps there's also further lessons to be learned from other international examples where there's increasingly a strong focus on how do we actively involve boys as part of the solution to be jointly championing girls' rights to an education free of such behaviors. And I think this is really where we have to also strengthen reporting mechanisms and follow-up. You may have seen perhaps that recently this has been a major concern in the UK. There's been widespread media attention about problems of sexual harassment and sexual assault in UK secondary and tertiary education institutions. And what that is highlighting is the disconnect there between reporting and then active follow-up and lesson learning from that. So I think this is something that, collectively as an international community, we need to be providing better guidance and minimum standards of what those follow-up mechanisms should look like, but also recognizing that there needs to be persistent, that we need to, if we want to bring about a broader cultural shift in gender norm change, this is not about short-term projects, it's about institutionalizing those mechanisms at scale. And I think that's where the potential of the Adolescent Student Program is very exciting in the context of Bangladesh. And then perhaps finally, just to also underscore the point that you made about the need to focus on strengthening adolescents' psychosocial well-being, and particularly at this time where some of the root causes that this research identified, including social isolation that girls in particular face and which has been exacerbated by COVID, and then also concerns about educational futures, again magnified by the current pandemic. So here I think there's really an urgent need to be investing in community-based and school-based psychosocial service provision, both through virtual low-tech options as well as in-person platforms, if we're really going to get on track to realize the commitment in SDG 3 around health and well-being for all. And then perhaps just finally to end on the note about voice and agency, I think what both reports highlight is that while adolescents have a real hunger and interest to be more involved in participating in school governance committees as well as community level activities so that they can enhance essential soft skills of communication and negotiation and learning how to become future leaders, that at the moment those opportunities are sparse, and where they are, they're often quite tokenistic. So this is an area where again we need to really be investing now if the promise of improving the economic and political empowerment of women as laid out in SDG 5 again is going to be realized. We need to be investing in those foundations at this critical juncture of the life course. So thank you very much and look forward to discussing further.
Thank you, Nicola. This is really, really interesting, and maybe we can pick up later because I think there are, you sparked off many ideas and I'd love to follow up later, but we're just running a bit short of time. I think about 3 to 5 minutes late, but it's my real honor now to invite our chief guest, Honorable Secretary, Ministry of Women's and Children Affairs, Mohammed Saidul Islam, to give his remarks. Sir, over to you.
Thank you very much, Dr. Imran Mateen, Executive Director, BRAC Institute of Governance and Development, Dr. Sabina Faiz Rashid, Dean, BRAC James Pickard School of Public Health, distinguished guests, presenter, discussant, participant of the webinar. Assalamu alaikum and good evening. At the very outset, I would like to seize the opportunity to recall our father of the nation, Bangabandhu Sheikh Mujibur Rahman, who ensured gender equality and empowerment of women in the Constitution of Bangladesh. He enacted Children Act in 1974, 15 years before the UN International Child Rights Convention. This legacy of empowerment and protecting the right of women and children has continued under the leadership of Honorable Prime Minister Sheikh Hasina through pragmatic and well-targeted plans, Vision 2021 and Vision 2041. A momentum has been created for achieving SDG goals by 2030 and taking forward Bangladesh to a high-income level country by 2041. I am very pleased to attend this webinar on a critical and time-befitting issue organized by BRAC Institute of Governance and Development in association with BRAC James Pickard School of Public Health and Innovation. Honorable Chair, distinguished guests and participants, we are living in an age of unprecedented evidence of pandemic. Governments around the globe have been grappling with double challenge of containing the health pandemic through lockdown and social distancing measures and responding to the social and economic disruption, threatening the livelihoods and well-being of the women and men, and especially the children, including adolescent, that includes more than 22% of our total population. This webinar has highlighted the poverty, education, and psychosocial well-being of the adolescent who were attending grade 7 and 8 at the time of school shutdown. From the policy brief and the presentation and discussion, we have been enlightened that adolescents have had enormous difficulties in the terms of poverty of their families, closure of educational institutions, access to online classes, and psychosocial welfare. It feels good to know that the adolescents have good knowledge on COVID-19 issues like spread of virus, benefiting of using of masks and sanitizers, and also shown satisfaction about the measures taken by the government to combat COVID-19. And in fact, the Bangladesh is now the global leader in crisis, disaster, and pandemic management under the auspicious leadership of our globally acclaimed Prime Minister of Bangladesh, Honorable Prime Minister Sheikh Hasina. Bangladesh is one of the first 10 countries of the world who got corona vaccine under the leadership of our Prime Minister. The government approved and distributed a 20,000 crore stimulus package for the cottage, micro, small and medium enterprises, and 200 crore for expatriate workers. Taka 2050 is being provided as cash support to 3.6 million families who have been hit hard by the ongoing pandemic. Special initiatives has been taken to create e-commerce platform, to create marketing facilities of products of women entrepreneurship and of grassroots levels from over the countries. Government is providing good support to vulnerable women under social safety net program for 1.04 million women and cash support. Sorry. And cash support to 1.045 million pregnant and lactating women for ensuring their nutrition need. Besides, another robust program has added new dimensions for vulnerable women to be graduated from poverty with cash support of Taka 15,000 each in order to make them self-reliant. Bangladesh Bank is providing collateral-free loans up to Taka 2.5 million to women entrepreneurs. Different kinds of microcredit loans are being provided to the rural poor and destitute women for eradicating poverty and creating opportunity for self-employment. Direct reliefs are also being provided to the poor and people in need. Ministry of Women and Children Affairs is the least ministry in promoting women empowerment and protecting their rights, as well as mandated to address the society with gender equality, adolescent and child protection. Ministry of Women and Children Affairs has established more than 5,000 adolescent clubs that includes 500,000 of adolescents. And there are 30 adolescents in every club, 20 of them are girls and 10 of them are boys whose ages are between 10 to 19 years. These clubs support to discuss health education and other issues related to adolescents. The clubs are run by peer leaders who are trained on social issues like child marriage, dowry, their sexual and reproductive health rights, etc. The clubs also organize local support groups meeting, parents meeting, fathers meetings, etc. Accelerating protection of the right of children project is also facilitating 2,100 adolescent clubs to empower the adolescents to perform as the change agent in hard to reach areas. Under this project, different activities have been initiated like awareness building program, distribution of masks and hand sanitizer to fight against coronavirus, awareness against child marriage, to improve psychosocial health of the adolescent. A number of entertainment programs like broadcasting drama, telefilm, etc. are going on during these pandemic situations. Besides, leaflets are distributed among the teenagers about safe internet use and online activities. Social media, another great platform for motivating young children, is used by APC project to keep the teenagers engaged positively. To prevent any kinds of gender-based violence, Ministry of Women and Children Affairs established a national helpline center for violence against women and children. This widely known toll-free helpline 109 is accessed both from mobile and land force for 24 hours in 7 days. This helpline is playing effective role to prevent all sorts of violence, to stop child marriage. It is to be noted that toll-free helpline has been incorporated in 250 million textbooks of class 6 to class 11. National toll-free helpline 109 is being operating 24 hours, 7 days, as I told you, a week during COVID-19 pandemic with special attention. The helpline is providing the information to the public about the services for protection of coronavirus, medical support, and other related supports. Ministry of Women and Children Affairs offers this free tele-counseling and online counseling along with their ongoing services by the clinical psychologist of National Trauma Counseling Center, NTCC, and 8 Regional Trauma Counseling Center, RTCC. from April 5, 2020 till now, where there were 1,610 children have received counseling services from NTCC and RTCCs. Among them, most were adolescents. It is notable that before pandemic, most of the adolescents came to these centers for their anxiety, depression, parent-child conflict, and unable to concentration in study, conduct problem, etc. But during the pandemic situation, the psychological problems of these groups have found diversity and severity. The clinical psychologist helped to understand them about their problems by their own, how to maintain this type of problem, motivate them to think beyond the box, involve themselves to do some humanitarian activities from their abilities and realities, relaxations, yoga, along with sleep hygiene. Besides, these clinical psychologists also provide ideas to develop their skills according to their interest in both academic and personal life instead of non-desirable activities with their age. Since April 27, 2020, a Facebook page called Psychosocial Support for Coronavirus has been launched through the social media, where at regular intervals, there are video clips, flowcharts, and live programs on the various psychosocial problems of corona-related children and adolescents. During pandemic situations, through virtual certificate courses named Counseling Skills for Everyday Life has been offered to general people where daily basic communication skills, stress and anger management, balance with work life and personal life, crisis management, dealing with family relationships have included. Total 125 participants are attending this training from all over the countries and abroad. Before pandemic, to ensure sound development of the adolescents, NTCC organized supportive counseling training, awareness training, and community-based primary psychosocial counseling training for 1,305 teachers from secondary schools in different districts. Besides, there are a total of 1,270 students also received awareness training and community-based primary psychosocial counseling training from NTCC. Distinguished guests and participants, I would like to appreciate BRAC Institute of Governance and Development for sharing this brief on adolescent experience of COVID-19 in Chittagong and Sylhet division. Would request for the full report to analyze and find out the possibility of incorporating into our policy. Finally, I must say that we all need to work together to listen to the adolescents, to give priority to their opinions where applicable, and to give them a healthy and prosperous life. Thank you all.
Thank you so much, sir, for your remarks. I must say that I would be really personally interested in, having a copy of your, your speech, because I think you provide a very, detailed account of the activities the government is doing, and I think that would be very, very useful for us, as sort of researchers. So that would be very, very useful. And again, following up from your last point, we'll be very, very happy and interested to not only share our report, but actually maybe have further consultation with the ministry, because I know the adolescent strategy, the national adolescent strategy, is something that MOCA is basically spearheading, and we would like to, have further consultation with you in terms of the actual programmatic implication of some of our research finding and what actually can be done. So I would really, hopefully you will invite us at some point for us to have some further consultation from this research. So thank you very much, sir, for your comments. So at this stage, I would like to invite Dr. Sabina Faiz Rashid, Dean, BRAC School of Public Health, to give closing remarks and her final reflections. Sabina, over to you.
Hi, thanks, Imran, and thank you to Nicola, to the team and the distinguished government guests. I'm not going to go on for too long because it's been a long day. Just to say a couple of things, because I don't want to repeat, but I think for James P. Grant School of Public Health, we have a huge focus on adolescents and youth because we work in the Rohingya camps, and this GAGE project, I wanted to commend Nicola because of a foresight of having longitudinal qualitative with quantitative, because I think the qualitative research methodologies really give you insights on the diversity and the heterogeneity of experiences of adolescents by age, by sex, by where they live, their locations. And the study highlights a couple of things, and I'm going to just share 4 points before people switch off for dinner, lunch, or whatever else. Is that there was a national study that came out recently about, 70% more lives have been taken by suicide than by COVID in Bangladesh as of the time in last year, which just shows the level of mental, emotional distress going on. We did a series of mental health studies amongst university students, but also a survey in the Rohingya camps. And we found that amongst the young, it's sort of this triple kind of marginalization, because many poor adolescents are actually not adolescents. They live lives in between social adulthood because they have responsibilities of adults. A father's lost his job. He has to drop out. He has to work. So education and aspiration of education sometimes can also be cruel optimism. So there's a lot of optimism and hope. And then when that's taken away with COVID, with the opportunity of not being able to pay for an internet bill, having to share a television, being told that as a man or as a young man, you will get married and look after the family, whether it's in reality or not, creates a lot of emotional distress. We found with the national survey with young men, but also in the GAGE study, these men are reproducing certain kinds of gender norms because they're also perpetuating certain things that are accepted in those communities of their roles. So our study in GAGE also found the poorer you are, those young boys dropped out from school to support families, and the girls were expected to get married early. So while I agree with Nicola, it gives me hope to hear them recognize certain kinds of role models. I feel COVID has created a certain space for cruel optimism. This is anthropologists who wrote about people and their dreams that are taken away from them. And that's why I'm very excited that the government is here with us, because for us, it's very important to have those discussions and that space of how do we integrate these different approaches. And I really appreciate Nicola, Imran, Mainapa, Farhana, and others discussing how counseling, whether it's on the phone, whether we can actually orient parents or even teachers, because often a few words can make a difference. Another point I really wanted to make is that policies, we can't scale up. I mean, I know that because, if you look at GAGE, it's being done in many different countries, and there's even differences within regions and districts. And I think when we look at intersectional factors, disabled adolescent girls, those who've dropped out early, teachers who have less training, schools that are under-resourced, there is a sort of a domino effect. And I think when we look at policies, and I really commend the Bangladesh government and research like ours that bring about evidence on this of how do we recognize and keep equity, because I know one of the big things for the GAGE project is creating that equitable space, creating gender equality, and that means looking at it in a very comprehensive way. And that's why I'm so proud to be part of this qualitative longitudinal, because I think that will give us those stories that we saw in today's presentation. I also want to just finally wrap up that there are simple, innovative solutions. And I think we can learn a lot from Ethiopia and Lebanon, where they're dealing with conflict and wars, to kind of emulate and learn, because I think there's a lot of opportunities to learn from each other. I do know that BRAC's education program is doing interesting work around radios and committees with school teachers getting training. One final point I wanted to add, because I don't want to repeat myself, given the excellent feedback given by all the speakers, and Imran very eloquently shared a lot here, but also Nicola, given her sort of global perspective, is that can we kind of remember that teachers themselves need refreshers? This gap that's happened, not only has there been an impact on students, teachers need refreshers to relearn, but also what is the curriculum? How do we need to revamp the curriculum, make it a little bit more real and address those gaps and work with adolescents? And I think this is where qualitative comes in, where you can understand adolescents' needs, the gaps and challenges, which is what we saw with adolescent clubs years ago with the GAGE project. I don't know if you remember, Mainapa and Nicola, we found that older adolescents were asking for different things in adolescent clubs compared to 12-year-olds. So I want to wrap up before I get dirty glances from everyone. It's been a long webinar, but I wanted to say thank you. I think it's a great project, and we work closely with obviously BIGD and the government, and we would be part of these consultations. So I look forward to these discussions and continue to make a change and work with obviously Nicola. So thank you, Nicola, and Sylvia. Sylvia is probably having a baby right now. So thank you very much. Okay.
Thank you very much, Sabina, and thank you, everyone. Hopefully, we will continue this conversation in some form or other. But we really look forward to policy discussion and actual intervention. So that is exactly where we should focus. I'm sure, along with colleagues from School of Public Health and IPA, we would really like to continue this discussion and take it to the real world, as Sabina basically said, and that often is the challenge, and that's where we would like to really contribute. So thank you all very much.
Thank you.
Thank you.
Assalamu alaikum. Thank you. Thank you. Bye-bye.